Hello, so this is going to be the last video blog update that I do. I am now over a year post-op. Wow, how fast did that year go? Firstly, before I even start this update properly, I just want to say thank you to everybody that supported me through this crazy journey. It's been really helpful to know that I've had people on my side to support me along the way, particularly in the first half of the year when it was quite a tough recovery. But yeah, so I'm here now, like I say, over a year post-op. I was going to do this update when I was exactly a year post-op, but life's just so busy in a really good way. So yeah, so we didn't get a chance to get around to it until today. So here we go. I hope everybody's doing really, really well. I hope these blogs have really helped people. I know there's a couple of you in the early stages of recovery at the moment, so good luck to you. It does get easier, I promise, and I'm sure that once you're in the same position that I'm in right now, you'll look back and think it was definitely the best thing you ever did. And that's where I am at the moment. Totally amazed by the results that I've had. My surgeon, Mrs. Cat, has just performed what I would call a miracle on me. If you've watched my previous blog updates, then you'll know that I lost 6 stone in weight 3.5 years ago, which left me with a considerable amount of loose skin in my abdominal area. And I decided to go ahead and have a tummy tuck. So basically I had full muscle repair, so all the muscles sewn back together, I had all the skin cut off, and had that done on the 22nd of January 2014. So like I say, we're just over a year post-op now. The recovery isn't easy in the first couple of months, and you'll probably know that if you followed my blog, that in the first few weeks particularly, it's not the nicest time. It's hard going, it's tough, it's physically, it's really difficult to get around. You're in pain, but you know, you get past it, and you don't go into this operation thinking it's going to be easy. Well, you shouldn't really, because it's not. But everyone heals differently, and you know, I've known other people who have had the same surgery and they've bounced back really quickly. So maybe I'm just a wuss, I don't know. But I certainly struggled in the first couple of weeks. But you know, you get past it, you move on, and you know, you come out the other end. So I'm fully back to normal now. I don't have any real side effects from the surgery anymore. Swelling is the thing that takes the longest to go. This is the question that everybody asks me about, is the swelling. The initial swelling lasts a couple of months, and then that sort of starts to go away. But then you get this intermittent swelling. So you get swelling when you've done too much, swelling when you've been on your feet too long, swelling when you've eaten the wrong things. And it's really frustrating because you never know when it's going to come, and you can guarantee it'll be when you want to get in that really slinky little dress and you'll wake up and go, oh, for God's sake, I'm really swollen today. So it's difficult and it's frustrating, but it's just part of the healing process. And when you've had a cut from one hip bone to one hip bone, you've cut through all your lymphatic system, and it takes ages and ages to heal. So all that fluid that's moving around from your feet coming up to your body is just getting stuck at the scar, and it just takes a while for everything to reroute itself. I don't really swell that much anymore. I do get it now and again. I get the odd day if I've done a lot, like if I've done a lot in the gym, or if I've been on my feet a lot, I've done a couple of long days in work, sometimes I notice a bit of swelling. But I think the other thing is as well, you've got to start to get used to your body again, because when you've lived as either an overweight fat person or with a flap of skin in the way, you don't know what's going on underneath there. So when you have things like your normal like monthly cycle, when you eat certain foods, you don't really notice what that does to your tummy in terms of bloating and things like that, because it's underneath all that either fat or skin. So when you've had the operation, it's about getting used to what's a side effect of the surgery and what is just normal. So you know, I've started to sort of learn to get to know my body again, really, and I know that I get a bit swollen and I get a bit bloated with hormonal changes and things like that. So that's normal. That's nothing to do with the surgery. That is just normal life. And you have to accept these things, that, you know, this surgery is going to get rid of loose skin. It's not a fat loss procedure. It's a skin reduction procedure. I just want to reiterate that, because I know despite having a lot of positivity about me having this operation, I have come across a lot of negativity as well, and a lot of that has been, oh, why don't you just work for it? Well, do you know what? I did work for it. I lost 6 stone. I worked my backside off for it. And unfortunately, there ain't no exercise to get rid of loose skin. So, you know, and that's what this operation's for. It's for loose skin removal. It's not for fat reduction. So don't get, you know, the impression that you can have this operation and you're going to go from looking, you know, like a size 18 to a size 4 overnight, and that you're going to have 6-pack abs and all that. It's not going to happen. You know, you're going to get rid of the skin. You have to be realistic about your expectations. I'm going to put my before and after photos on at the end of this entry, from before I had the surgery to to today, or photos that I took in the last couple of days anyway. But I just, again, I want to reiterate that my results aren't necessarily going to be everybody's results, because, you know, I have been working my tail off in the gym recently. So I've done a lot of work to try and tone my body, and I've been eating, you know, in a particular way. So it basically, what I'm saying is that if you want to get the best result out of this surgery, you have to work for it as well. You can't just go on the table, have your tummy tuck, walk out the door and think, great, now I'm bikini ready, because it's not really like that. You do have to put the work in as well to get, you know, the absolute perfect result. If you're happy with just the result that you've got after surgery, then that's absolutely fine. I'm not telling anyone that you have to go and, you know, kill yourself in the gym. It's what you want to get out of it. But what I guess, like I say, what I'm saying is, if you want to get the similar results to what I've got, you have to be realistic, and you have to realise that you do have to put the work in as well. So I wanted to just make sure that that was quite clear, really, on this entry. So I will actually put those photos on at the end of the blog. But coming back to, like, say, working out and things, you know, I struggled in the first couple of months because I couldn't do anything, and it really got me down that I couldn't work out anymore because everything was so tight and so fresh. But you get past it, and now I'm working out like harder than I ever have. So and I don't feel any pain, I don't feel any discomfort from it. My core is weak, and I'm having to do a lot of work on it, but that's partly pre-tummy tuck and partly because of obviously all that time that I had to really rest it. But I'm getting there, so I'm making progress, so I'm really, really pleased anyway. So yeah, I think that's pretty much all I've really got to say on it, really. Like I say, this is my last update. I'm not going to be updating again on this blog, but that doesn't mean that I'm not here for anybody that wants to ask any questions about the surgery, any questions about my surgeon in particular, Mrs. Cat. She works at the Spire Hospital in Solihull, and I think she works out of a BMI Priory as well, but in the Midlands area anyway, so that's where she performed my surgery. I was more than happy with the surgeon. She was absolutely brilliant. I'd recommend it to anybody. She's fantastic. What she's done for me it's just given me the confidence to you know, to live my life, really. I got married in October. I went on honeymoon to the Maldives, and I wore a bikini and felt absolutely great in it. So, and that's what this operation's all about, really. It's not all about just walking around in a bikini, but, you know, about having the confidence to just do the things in life that a lot of people just take for granted. And when you've worked your backside off and you've lost a lot of weight, as I have done, and as I know a lot of you have done, yeah, you want to be able to reap the benefits of that hard work. And when you can't, because you're looking in the mirror constantly and thinking, great, I'm not fat anymore, but hey, look at this lovely flap of skin that I've developed. It's really, it can be really soul destroying, and it can really start to tear your life apart. So, and that's exactly how I felt. And, you know, if you can live with that, then that's great. But for me, I couldn't, and surgery gave me that freedom from that, and it's allowed me to move on with my life and take things to the next stage now, and progress and move on and enjoy my life. So yeah, it can be massively life-changing. So like I say, anybody that is considering the operation, like I say, it can be life-changing. You can get fantastic results out of it, but please, please, please be realistic. The recovery is difficult. I'm not going to lie to you, it's not easy, and you have to put the work in, you know, before and after. So I wouldn't say go into this operation if you feel you've still got weight to lose. If you want to have it done, and you're happy with your weight and that's where you want to be, you know, then fine, that, you know, go ahead. But if you think, oh, I'll have it done and then I'm going to lose another 2 stone, don't. Just hold off. Lose anything that you want to lose. Get to the shape that you want to be, and then have this operation, because you will get a much, much, much better result, I promise you. And if you put the work in afterwards as well, it's really going to help to, you know, give you the best result possible. Certainly I've noticed that anyway, because I had a great result before I started, you know, putting no extra work in that I've been doing in the last few weeks. But certainly as I'm seeing my body changing again, you know, I'm just blown away by the results that I'm getting now. So it's great, because I couldn't have done it. I couldn't have the results that I've got at the moment from the work I've done in the gym without the toes. So it's all, you know, relative. So yeah, so I think that is it really. So I'll put my before and after photos on now. So these are my before and after photos. Like I say, the before photos were taken just prior to the surgery, and the after photos were taken in the last few days. Yeah, so here are those. So like I say, I'm very happy with the way things have gone. Like I say, not swollen anymore, no pain anymore. The other thing people have asked me a lot about is the scar. That's the other thing that people ask me a lot about. Oh, what's the scar look like? How bad's the scar? In all honesty, I really can't photograph it. It's so difficult because it's so faint. You just can't see it. So, which is a good thing. So, I had to wear micropore tape over it for 3 months, which kept the scar nice and flat, kept it out of the sun and all that kind of thing. And it's just the tiniest silver line from a hip to a hip, and the tiny little vertical one where my old belly button was cut out. But yeah, it's healed fantastic. I can't ask for any better than that. And like I say, it is super low. It's right on my bikini line, so you know, you won't see it. You know, it's a non-issue really. So like I say, I would have put photos on of the scar, but it's just, you just can't see it in photos, so it just doesn't show up, so it'd be pointless. But yeah, look after your scar. I've been using quite a lot of AVST Environ body oil on it, which is recommended by my surgeon. I used it on scars I had after I had my breast surgery, and they also healed really well. I do tend to heal quite well though anyway, so again, everybody's result is different. Some people are more prone to certain types of scarring and things like that. I am, touch wood, very lucky that I heal quite well, so I haven't really had any problems with my scar from anything that I've ever had done, thankfully. But I don't know, maybe if I hadn't used the oils and things like that, it would have been worse. I don't know, but it's healed really lovely, so I can't say that I haven't used anything on it, because I have. So yeah, thank you very much for watching my blog over the last 12 months. Like I say, it's been a completely life-changing experience for me. I hope the blogs have helped people. I'm sure there's a lot of you that started watching this blog a year ago that have now had your surgery and are already well on the recovery journey. Some of you that like I say earlier, that I know are in the early stages of the recovery. So yeah, good luck to you. I'm sure everything will be fine, and I'm sure you'll be chuffed to bits with your end result. And anybody else that's sort of new to all this and, you know, just discovering my blog and thinking about it, or, you know, considering it, knowledge is power. Read up as much as you can, and know what you're letting yourself in for. And if you can make an informed decision then on all that information, you think, yeah, I'm still going to go for it, then I don't think you're really going to have any nasty surprises. But yeah, so good luck to everybody, whether you're post-op, pre-op, whatever. And I'm sure there's a lot of people who've just watched this just for a bit of a nosy, and that's absolutely fine too. So yeah, that'll be me signing off for the last time. So thank you very much. Goodbye.